Yeah.
Awesome. Thank you for that. And then we're gonna go into antibiotics. So we had a question from, because I think we asked about what was your favorite topic, and then so from period 4, Leon, he asks, what are antibiotics, or why are they important?
Yeah, I mean, another really good question. So antibiotics are important to fight off infection, as I'm sure most of you know, particularly bacterial infections. And I feel like that's important to note. So what can go wrong with antibiotics is when you shouldn't take them and you do, or you're misprescribed antibiotics. So you shouldn't take them for something viral like a cold or flu. That's cases where antibiotics won't actually help fight that infection. So this type of misuse of antibiotics can contribute to antibiotic resistance, which means that you've developed an infection that antibiotics cannot fight off. And that's just something that we are concerned about, because that puts you at risk of a long hospital stay. You know, it becomes riskier when your body can't fight off an infection and antibiotics don't help.
Yeah, so the infection basically takes over because the antibiotics don't work.
Right. And so, you know, antibiotics are really important in some instances, like I said, bacterial. So they can kill germs that cause infections in some cases, but antibiotic resistant germs find ways to survive. So antibiotics kill good bacteria. They also kill good bacteria in addition to bad bacteria that can protect the body from infection. So that's why it's really important to only take antibiotics when you're supposed to, and take them properly. Take all of your doses when you're supposed to, finish them all. But yeah, basically the gist.
Yeah, and that's why I try to like really, I guess, make sure I make a point is always to say that like antibiotics, you must follow instructions from your doctor. Like you have to follow whatever the little label says, and then ask them follow-up questions as well as the pharmacist on how to take them, so that you prevent any issues in the future. Because everything you do now, you know, builds up in your body and can affect you later on. So that's definitely something that.
And it's important not to seek out antibiotics anytime you're sick. Like if you have a cold, like you don't need antibiotics. They're not going to help you. It's just your body will fight off that infection on its own.
Okay.
Yeah.
Thank you. Let's see. And then our question from period 5. So we have Brianna Bray. Is science facts? Are science always facts, or are they always realistic? So in general, the facts that we get that are given to us as science, are they always real?
This is another really good question. So science uses factual evidence to draw conclusions. While some aspects of science can change or evolve over time as new evidence becomes available, for instance, you start understanding the epidemiology of a disease better, then it can evolve over time. I think scientists generally, a good scientist should admit when they don't know something or don't have enough evidence to draw a conclusion. And I'll use HIV as an example. Like when the HIV epidemic first started back in the 70s and 80s, AIDS was essentially a death sentence. There was no effective treatments at the time, and people were getting really sick. Scientists didn't understand how the virus was spread. And now, you know, decades later, thanks to modern medicine and scientists working really hard in labs to understand this virus, we know that it spreads through bodily fluids like semen or blood, and we have really effective prevention measures for it, including PrEP, which is a pill you take every day that prevents the transmission of HIV among HIV-negative people. And then we also have really effective treatments like antivirals that people take every day, and that then they become undetectable, like the virus becomes undetectable in their blood. So they can lead a normal, healthy life, and it's no longer a death sentence. It's just kind of a chronic illness that you have to manage.
Yeah.
So that's what I mean by how like science it can evolve over time as more evidence becomes
Yeah,
available.
and the time span that you mentioned, it definitely evolved or like changed over time because like you said, this, I guess the real issue with HIV, you can correct me if I'm wrong, I guess it became like a big thing of focus in the 70s or 80s, but it wasn't until maybe in the last 10 or 5 years that people figure out how to manage that disease. Is that right?
Yeah, we've had antivirals around for a while now, but the medicine that you would take to treat if you have HIV, and they've just gotten better and better over time and more effective. So now if anyone that has HIV, if you adhere to your medication and you take your pills every single day, you can lead a very healthy life, and the virus will no longer even show up in your blood. So it will look like you don't even have the virus anymore. That's how good the drugs are now.
Oh,
And
wow.
the PrEP, the prevention prophylaxis that I was talking about is kind of like a birth control pill for HIV. You can take a pill every day. This is for HIV negative people that would prevent you from contracting the virus,
Okay,
even if
before.
you're engaging in risky behaviors.
Right.
Yeah.
Oh, wow. And so I'm just gonna like in my head, I'm kind of like I guess I want to relate it also to kind of like what's happening with Corona. So something as scary as like HIV and AIDS that was really like scary back when we were even younger or back before, we have found ways through science and through trying different ways of like, I guess, trying to solve the problem using like research and a bunch of brains like in one room or in different rooms sharing information. We have kind of found ways to, I guess, not make something as scary seem as scary anymore. So I feel like with
Yeah.
COVID-19, hopefully over time, or with everything that comes every so often, diseases that come and go, through the years, that like as long as we have people that are invested in scientific research, that those diseases can also become less scary for us. So
Yeah,
thank
that's
you for
where,
doing
yeah.
that stuff. That's like awesome, like thinking about everyday life.
Yeah, it's a good point. And I can just say that there are currently at least 400 or 500 clinical trials underway to figure out how to come up with an effective vaccine for COVID-19 and then treatments as well for people that are already sick with it.
Awesome.
So
And this has
scientists are
been,
working around the clock.
yeah. And
It's
thank you to every scientist and everyone that's involved in like keeping the human race healthy and everything around us too. We got to keep everything around us healthy as well for us to stay healthy. By that I mean the ecosystem. So we have to go into that too.
Yeah, yeah, I agree.
Let's see. So I guess we kind of like touched all the topics and we kind of answered all of them in a sense.
Mhm.
I don't know if you wanted to share anything else or, yeah.
No, I mean, I think that we touched on a lot. I can talk more about my specific job if you think that's of interest, and then we can end
Yeah,
there.
definitely. So for
Okay.
some of the students that are a little older, we have a couple of juniors and seniors. Like this might be of interest to them as they're going into college. What is your motivation and what drives you to be who you are and what you do every day? Yeah.
Yeah. When I was thinking back to when I became interested in public health, it really was those classes. And like when we met at SUNY Albany, I took the public health course, and that's when it really opened my eyes to this field that I fell in love with. But I specifically work on behavioral HIV surveillance, which means that we track the behaviors of groups in the United States that are at greatest risk for contracting HIV. So we ask people about like questions about their lifestyle and their behaviors, including sex behaviors, like whether or not they use condoms. We also ask about drug usage and alcohol use. We ask about homelessness and housing stability. And we ask about their ability to access healthcare services that they need to assess whether people are getting the resources that they need. And then all this information helps us track the HIV epidemic in our country so we can better direct HIV prevention and intervention resources where they're needed, as well as design effective HIV prevention treatment programs, for instance, PrEP, like I mentioned before, and adherence to medication. So that's kind of what I do in a nutshell. And my motivation, I think, is really just to help people. I've always been interested in helping people and being of service to the public. And I think I like the fact that the work that we do is impacting the entire population on a whole, and working toward protecting the nation's health and keeping you all like healthy and safe from disease. Yeah.
Yeah. Wow. Thank you. I mean, I really like that you also put an importance on finding something that you like to do, like really, you know, and also if serving other people like that in that capacity, you know, makes you a happy person and fulfilled, and
Yeah.
that's an awesome thing to go about and actually like reach your dreams. But yeah, can you give us just like a little bit of insight? How many years of schooling did it take for you to, or like what were the steps kind of in general to get up to where you are?
Yeah, so I did an undergraduate degree. I got a bachelor's, and that was just a Bachelor of Arts degree. My major was actually sociology when I was an undergrad. So I was always interested in people and studying people. And then I realized that during undergrad that I was interested in public health because there were some classes that SUNY Albany had offered. And I think now there's more undergraduate programs that offer public health specific courses.
Mm-hmm.
In any event, I went on for a master's degree, so I got a master's of public health. So I have an MPH, and that took, I think, just 2.5 years.
Okay.
So there's different types of programs. You can go full-time or part-time. I was working while I went. So it might have taken more like 3 years in the end, but it doesn't always have to.
Mm-hmm.
So I guess like 6 to 8 years total of school.
Okay. So you gotta stay in school for a long time in order to do something.
I know, it sounds intimidating,
like
but
that.
the time flies by and then you're done with it, and and
No,
then you
it's
miss
true.
school.
It is true. And then you miss school, yeah.
I love school. Yeah.
Yay, school.
Yeah, I do.
All right, Taylor. I thank you for taking out your time and answering these questions so really thoroughly and like with a lot of care. And I thank you for doing that. Taking your time out to do that, especially with all that's going on and everything. Yeah, I guess you could read your disclaimer again. I'll introduce
Of
that.
course. Yes, I'll just remind you all that the findings and conclusions in this presentation that I talked about during this interview with your teacher are those of myself, and they don't necessarily represent the official position of the CDC.
Okay, and with that,
Bye, thank you.